Dear friends, let us look into the image-based anatomy questions in the lower limb. If you are thorough with osteology, you will be able to answer questions related to the origin and insertion of the muscles. So this will benefit you in revising the muscles. Look at the image and try to recollect what bone it is, and then look at the arrows and then the numbers, and then start seeing the questions and recollect the osteology you have learned about this bone. So whenever a bone is given, we should be able to identify the bone, its side and surface. So this bone, what is it? It is the long bone of the thigh. It is the femur. And how to identify its side? And look at the rounded head which faces medially. So from that you will be able to identify the side. So it belongs to the right side. And what is the surface you are seeing? The surface is the anterior surface. You can identify that. The second part. So I have already given clue when I was discussing about the point 1. So this is the head of the femur, and with what bones it will be articulating, and then what type of joint is formed. So this is the head of the femur, which is directed medially, upwards and somewhat forwards, and then it articulates with the acetabulum of hip bone. It is covered with articular cartilage, and the joint that is formed between the two is the ball and socket type of synovial joints. So it is contributing for the hip joint. Then let us move on to the number 3. So what is this one? So this part is the neck of the femur, and what is the angle it makes with the shaft? So this is around 5 centimeters long, the neck of the femur, and it joins with the shaft at an angle of 125 degrees. 125 degrees. So that is the neck shaft angle. So that is what you have learnt about this neck shaft angle, which varies with age and build of the individual. It is smaller in adults and women and in short people. And the size of the angle is associated with the width of the pelvis, and it is increased in coxa valga deformity and decreased in coxa vara. So that is about the neck of the femur. Then what is number 4? So we have to identify the part and name the muscles attached to it. So it is the greater trochanter of femur, which is a quadrangular projection on the lateral aspect of upper end of femur, and you can see the attachments of it. Try to recollect the attachments to the greater trochanter of the femur. So what muscles will be attached to the greater trochanter of the femur? So there is the gluteus minimus muscle anteriorly, then there is an oblique ridge will be there for the gluteus medius insertion, then the apex and upper border of it gives attachment to the piriformis muscle, and on its medial surface it gives insertion to the obturator internus and gemelli. And there is a, you will see on the, when you see the other surface of the femur, there is the trochanteric fossa which gives insertion to the obturator externus muscle. So the greater trochanter you can remember as it is giving insertion to the muscles. What are those muscles? Gluteus minimus, gluteus medius, the piriformis, obturator internus and externus and gemelli. That's how you can remember the greater trochanter. Then coming to the next question. So see the fifth one. What is it? And try to recollect. What do you call that one? That is seen on the anterior surface. So this is the intertrochanteric line. Intertrochanteric line. And then what is attached to it? So from above downwards it gives attachment to the capsular ligament of the hip joint and iliofemoral ligament. So the strongest ligament in the body, the iliofemoral ligament, is attached to it. Not only that, in its upper part and lower part, it gives origin to the vastus medialis and vastus lateralis muscle. So it gives attachment to the vastus medialis and vastus lateralis muscles, origin to those muscles. So that is about the fifth question. Now let us see the sixth one. So what is the structure you are seeing? So what is that part? So that is the lesser trochanter. Lesser trochanter. So above you are seeing the greater trochanter, below is the lesser trochanter, between the two is the intertrochanteric line. So you have identified it as the lesser trochanter. And what are the muscles attached to the lesser trochanter? So it gives attachment to the psoas major muscle and iliacus muscle. Psoas major and iliacus muscles are attached to it. And if you see on its posterior aspect, there is a line along the lesser trochanter to upper end of linea aspera, which gives insertion to the pectineus muscle. So that is about the lesser trochanter. Hope you are able to recollect the projections or the important points on the anterior surface of the femur.